Let's talk about oppositional defiant disorder. I'm Dr. Barry, licensed psychologist, and I rarely diagnose ODD. I used to run a school-based program, and children that had ODD in their file were more likely to have discipline. The teachers were often less patient, and the families were often more punitive with these students. And do you know what the main treatment for oppositional defiant disorder is? Parent education and training, family therapy. And oppositional defiant disorder is often comorbid with ADHD, anxiety, depression, some other diagnosis. And when I have met with children referred because there was suspected ODD, when we met, these students were sometimes in foster care. They often had histories of trauma or losing a parent, significant grief, high levels of anxiety. And what others were perceiving as this child won't do this, they actually needed connection. They were lacking skills. They needed support. And in my experience, a diagnosis of ODD often makes the adult say, this child just won't do it. And they often stop connecting with the child emotionally and think this child just needs more discipline and this child just is not behaving. Instead of checking to see, does this child have undiagnosed ADHD? Is there an undiagnosed learning disorder? Are they just stuck? Is there neurodivergence like autism that hasn't been diagnosed? With ODD, people often stop getting curious and they just start expecting compliance. Now, when I do a psychological evaluation and a child is showing signs of oppositional behavior, I often try to talk with the child, I talk with the family, if I'm able to communicate with the school, and we come up with recommendations and ideas for how to address that in those fields, in those areas. I do diagnose conduct disorder. So conduct disorder is where, that's a step up where now we're breaking laws. But I've just seen people shut down when they see ODD and not look for, is there something else? Families coming in wanting an ODD diagnosis, but the child's ADHD isn't managed at all. Or there aren't appropriate expectations. So a 15-year-old with ADHD, the parent is expecting them to never have any missing homework, never talk back, never do any of those things. And it's we can have appropriate consequences, but this is still going to be a struggle. This is still going to be an issue. If I need a longer video, let me know. I hope that's helpful.